Good evening, everyone. Sastrikal. I hope that you all have taken the test. A good number of you. In the online MBBS.com video library, you have the test. Every day evening 8 p.m. A new test become uploaded. Full-scale grand test with all 300 MCQs, image-based questions, clinical vignette-based questions in the same pattern of the actual NEETPG. So, Ammaji, Shehnaz, Indira, and Chinapa, Satya, Sean, Chaco, Gitanjali, Amit Jain, and everyone who are all online. So, from now till January 4th, we're all going to sail together. So, don't forget to take the test before this discussion. Only if you take that full-scale grand test, when the negative marks are applied for wrong answers, what is your final score? If you are able to get it, then only your confidence improves. And everyday test, after the test is over, please pick up 10 to 15 topics where you are really going wrong. And go back to the online MBBS.com video library and invest another 3 to 4 hours of time in order to drill those concepts, those particular high-yield topics. That is the whole idea. So thank you all for joining the session. Let's make the great beginning. Please keep punching your answers so that you're actively vibrant. Also, please do comment, add some extra points that come to your mind. All that is required, because it is a team effort. As a group together across the country, we are all preparing together. So let's make the great beginning, doctor. A 36-year-old G1 P0 is at 39 weeks. Her fundal height is 36 centimeters. Fetal weight is 3,200, but the amniotic fluid index is only 3.5. Now, what is the most appropriate next step you want to do? So, basically, any AFI less than 5 centimeters. What is it? Indicative oligohydramnios. So, whenever late in the pregnancy, if there is unexplained oligohydramnios, because if you look at the amniotic fluid, ultrasound earlier was normal, so it suggests placental insufficiency. So that is the reason you need to do the induction of the labor and go ahead. Now, what are the possible etiological causes of the oligohydramnios? The list you should be sure, doctor. Whenever there is a renal agenesis, what is the main source of the amniotic fluid? It is the fetal urine. So that is the reason any renal agenesis in the fetus lead to the development of oligohydramnios is what you need to remember. Now, doc, pregnancy termination. What is a true statement about it? A single induced abortion will not cause any future pregnancy complications or sterility. That is what you need to reassure the pregnant woman. 34-year-old G1 P0 comes to the clinic at 25 weeks of gestational age. She has a normal level 1 ultrasound at 20 weeks of gestation. The patient's BP is normal. Fundal height is 26 centimeters. You are able to auscultate the fetal heart sounds. You are unable to. And there is a fetal demise. So what do you want to do in that scenario, doctor? There is no yes, due to oh, good. Indira gives a mnemonic for you to remember. Now, whenever there is a fetal demise, you need to do induction of the labor, is what you should remember. There is no role for cesarean in case of the intrauterine fetal demise. 18-year-old at 36 weeks, copious watery vaginal discharge. Shinaz is asking, sir, why not cesarean? No. If the intrauterine fetal death is there, you should never do cesarean. It is the induction by which you should be able to get the fetus out. That is the most important principle, Shinaz. Right. Manish is giving a very good way to remember Dr. Shinaz. No baby, no scar. So that is the point. Now, doc, she has a discharge that is running down her legs for the past 24 hours. 36 weeks of gestational age. So you need to do speculum exam and nitrazine test. So whenever there is a rupture of membranes, whenever you are suspecting rupture of membranes with a increased vaginal discharge, so the protocol is to confirm that. A 26-year-old woman, typically she is presenting with a swelling and 4 centimeter erythematous non-draining vulvar mass. So what is the typical vulvar mass, doctor? Bartholin's. So that is the reason incision and drainage is considered to be the management of choice for the Bartholin cyst and abscess. Please don't forget, one of the favorite questions of the examiner. So all the online students, please drop a line in your classmates WhatsApp study groups and your classmate WhatsApp groups. Everyone, you belong to a batch of your classmates, right? So drop a line that the live class has started, inviting your friends to join this live online discussion. Every day afternoon 2 to 4 p.m. we will be having to review the full-scale grand test. 29-year-old G0 presents with intermittent postcoital spotting. She never had sexually transmitted disease. She has a normal annual pap smear for 5 to 6 years. Then what is the most important diagnostic test? Always the rule is, any woman in reproductive age with abnormal bleeding or spotting, you should evaluate for pregnancy, is what you have to basically remember. Very good point. Ashish Mishra is asking, marsupialization when we will do? Already there is an abscess. What is the principle of abscess? Abscess anyway, drain it. That is important. So cyst is different from abscess. Now, a 49-year-old G0 complains of moderate vaginal bleeding 3 weeks after her period. Her menses are usually regular, occurring every 28 days, lasting for 3 to 4 days. And she has a vaginal bleeding 3 weeks after her period, which lasted for several hours. So how do you want to evaluate this 49-year-old lady? So any mid-cycle spotting, that is hormonal in origin. So you should always look for any endometrial cancer, cervical or uterine polyp or fibroid. You need to basically evaluate. Now, 42-year-old G2 P0, monogamous in her relation, and she is having increasingly heavy menstrual period. She has earlier 2 miscarriages. You have done saline infusion ultrasound. So what you are able to see, doctor, in this, you are able to see in the fundus, uterine fundus, polyp. You are able to see a mass, which is generally fibroid. So that is the reason you need to do myomectomy. That will also improve her fertility, success of fertility is what you need to remember. So what is important in fertility management, doctor, is if there are any reversible causes, you're a very happy person, you can always tell the lady that a reversible cause is being detected. Suppose you found adhesions, you found TB, you found PCOD. They all have a good prognosis because you can be able to reverse the cause. Only challenge is idiopathic causes where all investigations were negative but still fertility is not happening. That is going to be a challenge. Now, a 27-year-old woman, vulvar rash, approximately 2 weeks. What is the most common non-infectious vulvar disease in the members of the age group of 27-year-old sweet-looking women? What is the most common cause for a non-infectious cause for a vulvar rash, doctor? Lichen simplex chronicus is the condition which you should not forget. So, mechanical irritation with scratching that lead to epithelial hyperplasia, which is called lichen chronicus simplex. With regard to the syphilis, the primary syphilis chancre will be painless and typically develops 3 weeks after inoculation is what you have to remember. Now, gestational diabetes, fetal weight of 5,100 grams, though the fetal anatomy and amniotic fluid are normal, what do you want to do? If the dates are uncertain, what do you want to do? You need to first look for the fetal maturity because the macrosomic babies of a diabetic mother are at a great risk of developing fetal lung immaturity. So there is an amniotic fluid lecithin sphingomyelin ratio is the one which you have to basically check. Now doctor, a 32-year-old G2P1 woman, let me once more tell you doctor, all the clinical vignette based cases, questions, whatever that we are discussing now, it will be very interesting if you take the test. Please don't forget. You take the test 3.5 hours, 300 MCQs, just like actual exam with negative marking, right? So see whether you are able to crack at least 210 questions out of 300 correctly. If you are able to do that, you are almost in the path of winning, right? So, if you have not taken the test and attending this live discussion, at least attend. I'm not saying don't attend. If you have taken the test and attend this live discussion, wow, this will be very interesting, right? So, very, very interesting. And after this test discussion is over, we will be uploading this video, this PowerPoint into the onlinembbs.com video library. So you have then a test, you have the video, you have the PPT, all the three available, right? So every day you are able to solve 300 questions. Next 34 days you are able to finish about 11,000 questions. And every test ke baad, if you are able to improve yourself, identifying what are those 10 topics where you need to improve. Wow, that's more than enough, doctor. You are going to be the winner. So the whole job and the challenge today for any mentor or teacher is, you're all knowledgeable guys. Today knowledge is available at a fingertip on the smartphone. How to motivate you people to master all the expectations, all the high yield facts, single liners, list to remember, logical questions, classical clinical vignettes, and all image based questions. How to make you motivated to be on the path of the war in order to go for the tomorrow's NEETPG exam. How can we motivate you? Are we successful in doing that? If we are successful, then I'm very sure that is the whole purpose of mentoring brilliant guys like you for topping the NEETPG exam. So doc, 32-year-old G2P1, right? 32-year-old G2P1 woman at 32 weeks. And her BP is 135 to 155, 95 to 110, it is in that range. 24-hour urinary collection shows 160 milligrams of protein. Now, what is the medication best in this given scenario? Without a significant proteinuria, proteinuria is most important indicator, just not hypertension, for you to make a diagnosis of preeclampsia. So that is the reason, but still you need to take care of hypertension. So that is the reason you need to give labetalol is considered to be the management of choice. So, Shweta ji, sir, yesterday's test and discussion video not found in website. No, it will be there, doctor. No worries. What you can do, 9000-868-356. Our helpline is there, no? Just please WhatsApp or give a call to them, and they will help you to identify where is the test located, and you can be able to. Shina Sarfar says, even I could not find. Oh, is it? It's very simple, right? Let me check for all of you. So once you go to onlinembbs.com, doctor, yeah. See, you are able to see, no, doctor, this one, this folder, NEETPG mock test. You are able to see, right? NEETPG mock test. So once you go to this NEETPG mock test, you are landing on this page. Okay. So once you can come here, all the mock tests are available, right? So what was mock test number yesterday? It was some 1800. What was the mock test number? Can somebody tell me what's the mock test number? 1844 or 45? 44, right? 1844. Click it, right? 1844. Okay. Maybe there are so many mock tests. Here. Before the subject test. Right. So here you have according to the serial number of the mock test, you have the mock test available, doctor. So here you can be able to chase it. It's being published. So you can do you can identify, and in that particular folder, you will be able to get the test, you will get the discussion, everything. Can somebody, if possible, can punch the URL? Right now I don't have. If you can punch the URL. Yes. Devayan is asking, sir, can this 34 grant test for up to January 4th can be available in a separate folder? Not really required, doctor. All full-scale grant tests at one place will help you to get an access. That's a simple thing. Anyway, every day evening we are posting you the URL to reach the mock test. So that's the reason you need not worry. Okay? Anytime, always 9000-868-356 is the helpline number. So please help to get connected. Very good to see 75 online students, doctor. Very good, very good. Regarding ovarian tumor, epithelial cell tumors are the most common, is what you need to remember. Most of the epithelial tumors are serous and mucinous, endometrioid clear cell, undifferentiated, and Brenner's tumor. Now, which association is a true association? Immature teratoma. It arises from the yolk sac. Yolk sac tissue is what you should remember. So, immature teratoma is a germ cell tumor. It is derived from the embryonic fetal tissue, and it typically contains fat, hair, bone, etc., etc. One of the favorite questions of the examiner is he will give you an image-based MCQ in the tomorrow NEETPG. either histology of the different ovarian tumors, that is a very hot question for the examiner, or a gross appearance of the ovarian tumor. A lot of times previous aims and all India NEETPG question bank, you see a lot of questions of the gross images on the ovarian tumors. But remember, ovarian tumor, cervical tumor, endometrial carcinoma, hot topic, super hot topic hai. So I gave you all 953 topics, doctor, in the descending order of the priority. Every subject, 40 to 50 topics, descending order of priority. In that 953, top 30% in every list is super hot. What is the meaning of super hot? Out of that 300 topics comes the 200 questions. Examiner has 300 questions, right? Out of them, 200 questions come from the top 30% of this 953, that is 300 topics. First priority only, you have to study that. So, Dr. Dysgerminoma and LDH, they both are correctly matched. What is the most accurate description of that surgical procedure for the breast carcinoma, where you are including into the resection the breast tissue, nipple areolar complex, overlying skin, axillary lymph nodes, but the pectoralis major is being spared. Pectoralis major is being spared. What is that procedure called as, doctor? Modified radical mastectomy. Very good. Manish, Ammaji, Sindhu, all of you are absolutely right. Now, doctor, 26-year-old woman, hormone receptor negative breast carcinoma, right? Post-operatively, after the surgery, what is the best way that you can manage? So you should remember the combination chemotherapy, cyclophosphamide, methotrexate, 5-fluorouracil, also called CMF regime, is the one. So younger women who have more aggressive tumors, generally they respond best to chemotherapy, CMF regime, especially if the tumor's hormone receptor status is negative. That is very important. If you have done this question wrong, doctor, you cannot afford to lose a mark in breast cancer. Without breast cancer, NEETPG nahi hoga. So NEETPG is not for 300, it is only for 299 marks. 1 mark definitely comes from breast carcinoma. You have to definitely review that. If you have done this question wrong, please go back to the onlinembbs.com video library. Pick up all the questions what examiner asked in DNB, past aims, all India, etc., and be very sure on the treatment management, especially if the receptor status is positive, negative, premenopausal, postmenopausal, based upon the age and other criteria. What is the treatment protocol? You have to be 100% sure, doctor. Now, which features of the breast carcinoma patient's history points towards a favorable impact in the prognosis? Very important question. Question number 69. Come on, punch your answers, doctor. Punch your answers. What are the features which are considered to be having most favorable impact on the prognosis? Come on, let me see your answers. Question number 69. Question number 69. Yes. Ammaji is betting on progesterone receptors. Prasoon Vaidya thinks it is medullary. Bhavya thinks progesterone. Sindhu is thinking negative estrogen receptors. Oh, see, doctor. Prognostic factors for breast carcinoma. Very important parliamentary issue है, इसलिए अध्यक्ष महोदय आप सब प्यारे देशवासियों, you have to be 100% sure before you go to exam. So that list, earlier discussions I have provided to you. So please do review that. Be very sure by heart. दिल में लगा के जाना exam को, क्योंकि breast cancer is definite question and histology. I mean, what is a good prognostic features is the super favorite issue for the examiner. So doctor, you should remember medullary histology, medullary carcinoma is more frequent in young people. Even if it is aggressive, being common in the young people, it has a more favorable prognosis. Tubular carcinoma, mucinous colloid carcinoma, they are less common and they carry compared to the medullary is better prognosis. Now doc, 54-year-old G0 patient screening mammogram is showing 3 centimeter lesion in the upper inner quadrant of the right breast. Upper inner quadrant. Then you have done the ultrasound guided biopsy. You found an infiltrating intraductal carcinoma. And the radionuclide scan is negative for METs. CBP, LFT, they are all normal. And during surgery, the right axillary lymph nodes are noted to be firm, fixed and positive for metastasis. No other evidence of metastasis. What is the staging? Wow! This is what the examiner is going to ask you. He gives you all different permutations, combinations and make you to guess. It is T2, N2, M0. Stage 3A is what you need to remember. So the patient has a tumor larger than 2 centimeter but smaller than 5 centimeter, that makes it T2. There are METs to the axillary lymph nodes that are fixed, that makes it N2. And there is no evidence of distant metastasis, that will be M0. That is what you should remember. A lot of times, doctor, it is painful to remember certain things. But we have to remember, because examiner want to filter us that way. There is no other option, right? Because tomorrow in real clinical practice, no. As you see about 10 cases of breast carcinoma, you know how to stage it, right? But before you become MS general surgery, बाद में oncological surgeon, बहुत बड़ा ख्वाब रहना है. Still, to clear the NEETPG, you need to remember this. So अभी मैं 3 questions दिया breast carcinoma में in this full scale grand test. My main purpose is Tasmat Jagrata Jagrata, like Shankaracharya said. Tasmat Jagrata Jagrata. Be careful, be focused, be sure. What the examiner want, be ready and serve it. And examiner will gift you the NEETPG. the MD seat, be very sure. So आज आप 10 topics pick up करना है by the end of the discussion, where you are getting easily clean ball. 23-year-old woman presents to the clinic 5 days of worsening low abdominal pain. She has a uterine tenderness, pain on cervical motion. What is that called? Chandelier sign. What is the meaning of chandelier sign? Why it's called chandelier sign? In a woman who has pelvic inflammatory disease, if you try to do a cervical motion, it will be so tender that she will kick you with the leg that you will go and catch the chandelier. इसलिए इसको कहते हैं chandelier sign, right? Very painful on the moment of the pelvic examination. You have noted bilateral adnexal tenderness, but you cannot palpate her adnexa definitely. Her urine pregnancy test is negative. You diagnose PID. What is the next best part of the management, doctor? You have to admit and start giving intravenous antibiotics. Is the most important thing that you need to manage that woman with pelvic inflammatory disease is what you need to remember. A 31-year-old G3P3 presents 10 days after an uncomplicated IUD insertion. Her recent cervical cultures for gonorrhea, chlamydia, they're all negative. There is an increasing pain and vaginal spotting, that is her presenting problem. So she reports no intercourse with her husband in the last 5 weeks. She is ephemeral, but she has uterine tenderness on bimanual examination. What is your option? IUD itself is a risk factor for the development of the pelvic inflammatory disease. So removal of the IUD and give oral antibiotics is considered to be the management of choice, because post-IUD insertion, endometritis can occur. So that is the reason you need to, it's an indication to remove the intrauterine contraceptive device. 35-year-old woman from Mumbai has low-grade squamous intraepithelial lesion on her annual pap smear. She underwent colposcopic evaluation. At the time of colposcopy, the transformation zone was visible clockwise from 3 o'clock to 11 o'clock position. Now, when the endocervical curettage was also done, there is a normal ectocervix, and from the biopsy, high-grade squamous intraepithelial lesion is being found with no evidence of invasion. So, the endocervical pathology was negative. There are no adenomatous cells, atypical adenomatous cells on endocervical curettage. What is the option that you want to offer to this woman? So be very sure, doctor, how will you evaluate? Intraepithelial, squamous intraepithelial lesion, low grade, high grade. Similarly, atypical cells of unknown significance of adenomatous nature from endocervical curettage. There are algorithms which are available. You have to master it. Already we discussed, debated many times, and then made it available in the onlinemmbbs.com video library. So doctor, loop electrosurgical excision procedure, LEAP, is the one that you need to do. Because the patient has a tissue diagnosis and needs a treatment for her disease. The appropriate treatment is LEAP, and she is not a candidate for cryotherapy. Now doctor, very good. Shina Server is also thinking in terms of LEAP. Now once more, pap smear, if it is abnormal, what do you want to do? For how long you need to do pap smear? There are all recommendations available. Examiner's favorite area, cervical cancer के बिना अगर NEETPG पेपर हुए तो मेरा नाम मुरली भरद्वाज नहीं है, right? So doctor, definitely examiner is going to ask. Exam is not for 300 questions, it is only for 299, and that one question invariably comes from cervical cancer. So it's very easy, doctor. Cracking NEETPG is very easy. You don't need full 1 year long preparation, day and night, and burning the oil. No, not really required. What you require is first a clarity, game plan, clear plan, what to attack, what definitely examiner is going to ask. Otherwise, each book is 1000 pages fat. You take Datta Shah together, 1000 pages, Park, 1000 pages. इतना मोटा मोटा बुक का पूरा कहाँ पढ़ सकते डॉक्टर? You can't read. So you need to be super clear what examiner want, what I can deliver. So examiner want 953 topics. Last 15 years say questions are asked from this 953. Out of that also, from 300 topics in the descending order of the priority, 200 questions come, right? And remaining 653 topics, say 100 questions come. Out of that 100, anyway 50 questions are kachra questions रहते हैं. कोई भी आंसर नहीं कर सकता, खाली luck Luck. Book your luck with the God. But there are 50 questions you can still crack if you have read this 653 at least once. But even if you did not read also, no worries. If you are able to crack this 200 questions from the 300 topics with precision, like a Scud missile bombing, if you are able to do that, then if you are able to make another 20-30 topics out of 30 marks out of the correct out of the remaining 100 questions, khatam, khel khatam, dukaan band. You will be the topper another 60 days or 100 days. March first week May MD residency will begin, and this December winter become a history, a nostalgic memory. So that should be the goal, doctor. So forget about what you have done before December. I don't care. Now you start, now you get focused, now you do the revision and give your best in the next 34 days to come. Now doctor, level 1 obstetric ultrasound mein, which is a routine component, fetal kidney evaluation. So you should remember, fetal kidneys are examined on a routine obstetric ultrasound. The level 1 ultrasound usually includes location of pregnancy, whether it is intrauterine or ectopic, location of the placenta, is it placenta previa or normally placed, amniotic fluid assessment. It will also look for the fetal line, fetal biometric data for dating, and basic fetal anatomy. These are the things that are checked in the level 1 ultrasound is what you need to remember. So what is the main difference between level 1 versus level 2 ultrasound, doctor? Varies 300 topics. Bhavya is asking. See doctor, if you have not got that PDF, please call our helpline 9000-868-356. Barabar? Now, every subject, there are about 40 topics that I have given you in the descending order of the priority, based upon the last 15 years of All India AIMS, PGI, JIPMER, FMG, DNB, all these exams, every question ko hum label kiya. This question belongs to this topic, this belongs to this topic, and then we made 30,000 questions grouped into their respective topics, and then we checked it. Predominantly what examiner is asking. What is the first highest number of questions came? For example, in preventive medicine, oral contraceptive pills. Then second highest number of questions came where? Like that we arranged the topics after the analysis of 30,000 questions and labeling them. We have given the, created the list. So in that list, what I am saying is, if I have given you 40 hottest topics in the descending order of the priority in physiology, for example, only at least read the first 15 topics. Kitna ghanta lagta? Half an hour. So 7 to 8 hours you are ready. Right? So if you are able to review the top 30% topics in that 953 list and go to the exam, examiner के 300 questions में से 200 को आराम से आप आंसर कर सकते. That is the whole strategy, doctor. Right? Now, what is difference between level 1, level 1 में you will be looking for fetal biometry and rule out multiple gestation. Level 2 is high detailed targeted scan. You require an experienced sonologist who can be able to assess the fetal anomalies. Now, 20-year-old at 16 weeks of gestational age by LMP. She wants to terminate her pregnancy. What is the safest and most appropriate method, doctor? Dilatation and evacuation. It involves serial dilatation of the cervix followed by manual removal of the fetal parts and placenta using the forceps and suction as well as a sharp curettage of the uterus. It is very effective for mid-trimester pregnancies up to 18 weeks of gestational age is what you need to remember. Now, doctor, this itches. What is the best treatment? It is atopic dermatitis, so requires hydrocortisone valerate cream twice daily. Typically, she has a lesion which is accompanied by pain. How do you want to manage this herpes? It is not A. A is not the correct answer, doctor. It should be acyclovir. Acyclovir that need to be administered. So there is a little wrong answer in the key. Please correct it. Now, what is the age at which these lesions appear? In the flexural area, right? In the flexural area, and when do they clear? So once more, it is a case of atopy. So usually begin at 1 and by 15th year they will clear. Now what you are able to see is a diaper rash caused by a fungal infection like candida. So how do you want to basically manage? Miconazole 2% cream twice daily. You have to be very sure about. Diaper rash with yeast infection like candidiasis. You have to treat with miconazole. Now, a KOH revealed no hyphae, no yeast forms, and the wood lamp has shown pink fluorescence of these lesions. So what do you like to call it as? It is called erythrasma. You have to give erythromycin 2% solution twice daily till it clears, is what you should remember. A person is in process of sloughing the epidermis because of a drug eruption, as what you can see. What organism most commonly infects? So, it is the Staphylococcus aureus. This is the transient epidermal necrolysis, but it is at a great risk of getting infected with the Staphylococcus aureus is what you should remember. These lesions developed in a 30-year-old and they are intensely itchy. There are fine white lines and the lesions have a faint purple hue. What is your diagnosis? So, and prognosis. So typically it is lichen planus and it will resolve within 1.5 years. Now you are able to see typically the scabies involving the pubic area. So here the treatment would be lindane 1% solution for 10 minutes is considered to be the management of choice. The patient developed this eruption over the whole body. He developed these lesions, right, over the whole body after streptococcal pharyngitis. Though the pharyngitis was adequately treated with penicillin, what's the most likely possibility of this lesion? So classically, they are the lesions of psoriasis is what you need to remember. A child was about 1 year of age and developed a pruritic eruption. Pruritic eruption, right, at the age of 3 months. How do you like to diagnose it as? It is a classical case of atopic dermatitis. Now, what you are seeing here, these lesions, they are all actinic keratosis, solar keratosis they are called as. So, whenever you find solar keratosis, what is considered to be the treatment of solar keratosis, doctor? Typically, it is treated with fluorouracil 5% cream twice daily for 8 weeks is considered to be the management of choice. Now, the Effudex cream, it also contains 5% fluorouracil. is a vanishing cream base. It is recommended for the topical treatment of multiple actinitic and solar keratosis is what you have to remember. Now this woman has developed a photosensitive rash. Photosensitive, this is all photosensitive rash. So she was most likely taking which drug, doctor? Which drug she was taking? She was typically taking tetracycline associated photosensitivity. Now there are multiple lesions like this. These are all that flat warts, right? Just to breathe is asking, how can I get the important topics? Please call doctor 9000-868-356. WhatsApp or call and or call. You get it, right? And also become part of our WhatsApp study group. And you get wonderful classmates in our. We have about 20,000 students in about 80 WhatsApp groups, and all are very competitively preparing. And every 5 minutes we punch a question into the group, and all the group members, whenever they are free, they will basically respond by answering. So you are in the current stream. That is most important, doctor. You have to be part of that cohort, vibrant cohort. And today it is very easy because all our life is on social media, right? Yes. Now, these are all the flat warts, doctor. So, flat facial warts. Once more, 5-fluorouracil, 5% twice daily till clear is considered to be the management. This person with this kind of a rash, allergic rash, is having difficulty breathing. That is, he is having anaphylaxis. So how do you manage that? Epinephrine 1:1000 dose 0.01 cc per kg subcutaneously is considered to be the management. So that is the story, doctor. So a lot of people have an apprehension about image-based questions. They are very easy. Examiner will ask around 25 to 30 image-based questions. Another 25 to 30 clinical vignette kind of questions. 50. Remaining 250 biscuit questions. Single liners. Tuck, 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 tuck. It is like a gun placed on your temple. You know, you don't know, you are on the highway. So be very sure about it. So that is the reason it's not a test. NEETPG is not a test of intelligence, knowledge or anything. It is all about focus, clear strategy and perseverance, where you are able to master at least once all 30,000 MCQs of the last 15 years of the 6 question banks. AIMS, All India PGI, DNB, and the FMGE. You should be in a position at least touch base once. So on the onlinemmbbs.com video library, you have 2 lakh PowerPoint slides, 953 topics. They are classified into 30,000 questions from the 6 major question banks. And you have all this available in addition to grant tests, discussions, etc., etc. Additionally, across the year, we have no other work. Every day, 2 hours, you have Dr. Murali Bharadwaj as your classmate studying with you, live broadcast, so that you become energetic, activated to go back and review the video library, PPT slides and the knowledge bank, and then get ready for your exam. So please tell your juniors who are taking 2021 exam to subscribe to our onlinemmbbs.com video library and also become our companion in our journey next year towards becoming the topper. So doctor, The most common hypersecreting pituitary tumor. I'll try to run a little fast. Pituitary adenoma. Pascal's law is used in which hernia repair? भैया पास्कल लॉ होता है फिजिक्स में. फिजिक्स बहुत दिक्कत के साथ हम पढ़ाई करके एमबीबीएस में आ गया. एमडी में भी वो पास्कल लॉ के बारे में चर्चा हो रहा है. So doctor, what is Pascal's law? But before that, you should know Stoppa's pre-peritoneal repair is the place where Pascal's law is the one which is being used. So if you look at the hernias of the groin, inguinal hernia repairs, how do you do? Open pre-peritoneal non-prosthetic, open pre-peritoneal prosthetic, combination of anterior and pre-peritoneal and prosthetic, and laparoscopic inguinal herniorrhaphy. They are all the various techniques which are being used. So doctor, if you look at the open pre-peritoneal prosthetic, Reed, Revis, Vance, Stoppa, Rives, etc. So what is the principle of the Stoppa repair? All hernias of the groin, basically they begin at the myopectineal orifice of Foucault. So you will be replacing the transversalis fascia in the pre-peritoneal space with a large processes, and that will be extending far beyond this orifice of Foucault through which the herniation is happening. And what makes the processes in the pre-peritoneal space to be held typically intra-abdominal pressure is the one. So that is where Pascal's principle is being used. So this is the polypropylene mesh in the pre-peritoneal plane which is preventing the herniation is what you should remember. So what did Pascal's law say? It is a principle in which the pressure changes at any point. They are in a confined incompressible fluid. They become transmitted throughout the fluid such that the same change occur everywhere. So that is how that pre-peritoneal prosthetic material is being held in place. That is the examiner's question. पहला हमको स्टॉपा क्या है, लिचेनस्टीन क्या है मालूम होना, पास्कल का लॉ क्या है मालूम होना, और पास्कल लॉ स्टॉपा में इस्तेमाल करते बोल के मालूम होना. कैसे मालूम होता? बहुत मुश्किल है. So this is a bakwas question, but still you will have 50 bakwas questions in the exam hall. Suddenly when you come across this kind of question, there is some Atma which will be telling you, hey, A is correct Ray, B is correct Ray, you are very sure Ray, C is correct Ray. Even one time also not listening to what it is, we will be tempted to go and answer, and such a kind of seduction will land you in negative marking. So that is the reason, doctor, tasmat jagrata jagrata. Don't be seduced by the examiner's luring questions, 50 kachra questions out of 300, which will try to test whether you are really good student or you are doing the stone throwing job. Be very sure about it. Ammaji Nagreddy is saying, sir, I improved 20 marks compared to the last test to today test. Ammaji, Jindabad. That's good. That should be the spirit, doctor. Every day you should identify what questions what topics I'm really not doing well, and you need to improve. That's the most important part of the story. So, doctor, pleural fluid analysis, when you call exudate, typically when the ratio of the pleural fluid to the serum protein is more than 0.5, so you should know Light's criteria for considering transudate versus exudate. What is the meaning of balanced resuscitation, doctor? Permissive hypotension to decrease bleeding and limited crystalloid use. That's called balanced resuscitation. So there is something called damage control resuscitation. There is a lethal triad. Why people die? lethal triad. So balance strategy, what it says is, start early, increase the use of the fresh frozen plasma, and minimize the crystalloid use only as a carrier fluid for the blood products. And you do hypotensive resuscitation strategy, titrating the fluid resuscitation to lower the systolic blood pressure so that you can be able to provide a definitive hemorrhagic control is what you need to remember. Now, these are all the benign conditions of the breast. Fibroadenoma, galactosile, cystosarcoma phylloids, but not Paget. Paget is a marker of an underlying malignancy. Primary versus secondary healing. What is the main difference, doctor, between the two? You should remember there is more granulation tissue and fibrosis in case of secondary healing. Healing by secondary intention. Cat gut is not made from the cat. From where is it made, doc? Sheep. Good. Let me tell you once more. One MCQ examiner will ask you, doctor, right? One question will come from sutures. If you take any entrance exam, sutures. Without that, there is no paper. It is one of the hot 300 topics that I was talking about. Now, what is the most common site for the subclavian obstruction? First part. A patient has internal bleeding, blood trauma, abdomen. How do you want to manage if he is unstable? Ammaji is saying, sir, I am just going along the words of you. 100%. There is a very famous saying I always quote. Trust begins where the reason ends. You can't get into a temple and doubt, hey, you are a stone only, no? Are you really God? So, what I am trying to tell you, doctor, trust me, from past 20 years, around 2 lakh students I have spent time with, mentoring them. All students are more or less uniformly stressed out, uniformly attention deficit, right? So, examiner did not change. How can he change? He has a specific pattern, specific set of questions to ask you, specific set of topics to ask you. हम इस देश के वासी हैं जिस देश में टीबी रहती है. Without TB, can there be a NEET PG paper? No. In this country, breast cancer. Any country, breast cancer. In this country, cervical cancer. Right? Without that, there is no paper. इतना दारू पीते, इतना gallstones होते, without pancreatitis, there is no paper. Like that, examiner has a very clear a la carte to offer you, right? Be very sure for that a la carte. So doctor, you need to do fast, not the CT, because it is an unstable patient. So focused abdominal sonography for trauma. It is a subxiphoid, right upper quadrant, left upper quadrant, and pouch of Douglas. 4 different views that you need to remember. So, the right upper quadrant, perihepatic area, hepatorenal recess, Morrison's pouch. Left upper quadrant, perisplenic view. Suprapubic area, pouch of Douglas. Subxiphoid area, which is called pericardial view. And the preferred initial site where the fluid get accumulated if there is any trauma, free fluid will be the right upper quadrant, and you have to scan with 3.5 to 5 megahertz of frequency is what you need to remember. Yes. Now, what is the minimum fluid detectable by ultrasound in FAST? 200 to 650. FAST has a high sensitivity in detecting hemoperitoneum, even high specificity, but it has a low sensitivity for identifying specific organ lesions. and sensitivity can improve with contrast. They are the important principles. So whenever blunt abdominal trauma, what is the FAST algorithm? You do FAST if the FAST is showing positive free fluid. If the patient is stable, then do CT. If he is unstable, then do lab. If it is of intermediate probability, you need to do repeat FAST, diagnostic peritoneal lavage or CT. If there is no free fluid, if the patient is stable, just ask him to come for follow-up. And if he is unstable, then you need to repeat the FAST. That is considered to be the algorithm, is what you need to basically remember. Now, idiopathic hypertrophic pyloric stenosis. Erythromycin is implicated. Triangular area between labia minora and clitoris, what do you call it as, doctor? We call it as vestibule. So you have a clitoral body, glands of clitoris. There is a bulb of vestibule, urethral opening, vaginal opening, and corpus cavernosum, and the crus of the clitoris. So you have to be very sure on this anatomy. How will you evaluate the ovulation, doctor? Cervical mucus thickness, Spinberg, Keat, etc., tenacity can give you a clue. Pregnancy there is the increase in total T3. What is the normal weight of term placenta, doctor? Half kilo, 500 grams. Oligohydramnios होता है polycystic, typically होता है renal agenesis, premature rupture of membrane, GU obstruction, uteroplacental insufficiency. Whereas polyhydramnios is seen in the case of maternal diabetes, multiple gestation, isoimmunization, duodenal atresia, anencephaly, twin transfusion. So this list of etiology is the favorite question. Palmer sign क्या होता है? Palm में rhythmic contraction of the uterus, that's called Palmer. So what are the various pregnancy signs, doctor? Cervical sign, Goodell, seen at 6th week. Uterine signs, the shape, size and consistency. Piscasex sign. Hagar sign is seen between 6 to 10 weeks. Palmer sign is as early as 4 to 8 weeks. That is what you need to remember. So what is Hagar sign, doctor? Upper part of the body of uterus is more large by growing fetus, and lower part of the body is empty and extremely soft, and cervix comparatively firm. Typically that is called Hagar, 6 to 10 weeks. Palmer is regular rhythmic uterine contraction which happen at 4 to 8 weeks is what you should remember. Jacquemin Chadwick, what is that? Bluish discoloration of the anterovaginal wall and vestibule, which is visible at about 8th week of pregnancy. Then what is a vaginal sign? Typically Osiander sign. There will be increased pulsations felt through the lateral fornices at 8th week is called as the Osiander sign. Then cervix becomes soft as early as the 6th week, which is called as Goodell sign. So doctor, this pregnancy diagnosis, clinical signs, this kind of questions, no, everybody will answer. See, there are about 1,80,000 doctors competing for the NEETPG doctor. Remember, 80,000 of them will not be very serious. चलो भाई डालेंगे application, ये साल भी डालेंगे like a nomination. So 1 lakh will be bit serious. In that 1 lakh of your competition, generally we should never think of competition. Competition is with ourselves, but still, what I am trying to tell you the truth. Out of this 1 lakh, there will be about 60% of them who are repeating the exam. That means one full year they have given like a committed stem cell. 30% पूरा MBBS में बहुत sincerely पढ़ा. That means they have not done any sin, no girlfriend, no boyfriend, right? So 30%. Then 10% are smart guys, right? From MBBS they are smart guys. ज़्यादा नहीं पढ़ते, थोड़ा पढ़ते but focused पढ़ते और एग्जाम में रिजल्ट देखो मुझे सीट आएगा. That kind 10%. So you should identify, am I this 60% guy, 30% guy or 10% guy, or do I belong to this 80,000 chumma likhne wale? Which gang do I belong to, right? But what is most important is, in this 1 lakh, there are only 20,000 seats which are available in the prime specialties. So 1 in 5 you have to beat, right? Typically, in this 1 lakh serious guys, a good number of time will go, lot of people will go to this coaching, that coaching, face-to-face coaching, idhar jana, udhar jana, tension mein jana. Instead of actually, if you study in a focused manner, really study what is asked by the examiner, only stick to the 300 super hot topics and have a working knowledge in remaining 653 topics, no coaching is really required, right? And to solve 30,000 questions from the all 6 question banks, AIMS, All India, PGI, JETMAT, DNB, FMG. How much time do you take, doctor? You don't take more than 300 to 400 hours, right? So instead, we waste a lot of time. Honestly, everybody wastes that. But those guys who wasted less, those who are focused, those who created their own notes and very sure about what they are going to forget, but they should not forget kind of things. If you maintained a book by now, they are the guys who are becoming part of this 20,000 cohort. Okay, so that is the reason what my advice to all of you is, doctor, entire year you have done excellent preparation. I'm seeing you every day 2 hours, आपके साथ हम भी पढ़ाई किए, right? और अपन का videos 1000 hours of videos already video library में है, right? I know that you have done good work, but now this is the time where you get super focused and identify, for example, visual field defects. Where is hemianopia? Where is quadrant anopia? Blah, 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 blah. Always a confusing topic. I mean, if you don't get clarity, you need to revise. So all those things carefully revise in the next 34 days. That is the whole purpose and secret of winning, doctor. No tension, no anxiety, kuch bhi nahi hai. When Dr. Murli Bharadwaj is there with you. Right? That's good. So please attend every day 2 to 4 p.m. We conduct a live online discussion and discuss the grant test. Please join the session wherever you are. So doctor, transvaginal ultrasound ke liye you don't need full bladder. That's the point you need to remember. What is the most common cause of the spontaneous abortion? Any day chromosomal abnormalities. 34 weeks of pregnant female with uterine contraction, no other risk factors. How do you want to manage? You need to give a tocolytic for 3 or more weeks because 34 weeks. Preterm. Dexamethasone to improve the fetal lung maturity, expectant management should be done. So 34 weeks or more, proceed to delivery, usually by induction. Group B streptococcal prophylaxis is recommended. Preterm. Management of preterm rupture of membranes and preterm labor. 32 weeks to 33 completed weeks. You have to do expectant management, antibiotic prophylaxis, corticosteroids, antimicrobials. Then 24 weeks to 31 completed weeks. Similarly, before 24 weeks, what you want to do, you have to be very sure about all these protocols, doctor, which is not a predisposing factor for preeclampsia. Molar pregnancy, gestation diabetes, antiphospholipid antibody, they all can predispose to the development of preeclampsia. Positive Trendelenburg but is not due to maximus, it is due to medius and minimus. So what is the function of maximus, doctor? Gluteus maximus. Primarily, it is a superficial gluteal muscle. Primarily between the flexed and standing position, it will help. Similarly, tensor fasciolata. It flexes the thigh, tenses the fasciolata, is what you should remember. So Trendelenburg sign is because of gluteus medius and minimus, which are the abductors of the hip, is what you have to ultimately remember. Very nice to see 90 online students. Please punch a line in your WhatsApp study groups, calling all your friends to join this afternoon English tea with bread and jam. So afternoon is the best thing, and every day evening 8 p.m. as we host the test, please take an opportunity to solve it and join the discussion. So doctor, centromere near the end is called acrocentric, which is called third head of the coracobrachialis. It is the ligament of Stutter. Bhaiya, this is ligament of Stutter through which passes the brachial artery and the median nerve. That's the reason median nerve can get injured. And this ligament of Stutter is called the third head of the coracobrachialis. It is the fibrous band between the supracondylar process and the condyle. So median nerve can get injured in the axilla, in the ligament of Stutter, in the supracondylar fracture, posterior dislocation of the leg, of the elbow, or if there is any forearm or a wrist laceration. How is the base of the heart formed? It is formed by the left atrium, predominantly left atrium. Into the left atrium, all the four pulmonary veins, they get drained into, and typically the base of the heart is opposite the thoracic, T5 to T7. And how is it separated, doctor? It is the esophagus descending aorta will separate it from the spine. There is either any left atrial enlargement, as in the case of the mitral stenosis, that enlarges and it can compress the esophagus, leading to dysphagia, is what you should remember. Which muscles are used in the normal walk during the stance and swing? Tibialis anterior. Renal parenchyma is derived from metanephros. So you should know, doctor, kidney में 3 component होता है: pronephros, mesonephros, metanephros. Pronephros are the cervical segments only present early 4 weeks. They are non-functional, no adult derivatives. Mesonephros, thoracic and lumbar segments, they form later in the week 4, and pronephros is like the interim governor before actual governor or prime minister comes. Until the week 9, you have mesonephros. And they also give rise to reproductive structures, mesonephros. Metanephros forms within the pelvic region. It appears on week 5 and it becomes the definitive kidney of the fetus by week 10. Week 10 is what you have to remember. So what are the derivatives of this metanephros? Who is going to be finally the kidney? There is a metanephric diverticulum or ureteric bud and metanephric blastema. Ureter, renal pelvis, calyces, collecting ducts, they are all metanephric, diverticulum, ureteric bud derivatives. Bowman's capsule, proximal convoluted tubule, loop of Henle, distal convoluted tubule, they are all metanephric blastema, is what you should understand. So the metanephros is the third and final stage of the kidney development, is what you have to remember. Now doctor, axillary artery को divide करने वाला muscle क्या है? that is pectoralis minor, divides it into first segment, second segment and third segment, and you should know what are the branches. First segment is before pectoralis minor crosses it, superior thoracic artery. It supplies the first and second intercostal spaces. Second segment को दो branches होता है, thoracoacromial, lateral thoracic. Third segment को 3 branches होता है, subscapular artery, posterior humeral circumflex artery and anterior circumflex artery. भैया मैंने बोला ना, without one question on epithelial lining, branchial arch derivatives, there is no NEETPG, right? Without one epithelial lining, one branchial arch derivatives के ऊपर क्वेश्चन नहीं है तो NEETPG में मेरा नाम मुरली भरद्वाज नहीं है. इतना कॉन्फिडेंस से मैं आपको बोल रहा हूं. 300 super topics from which 200 questions sure shot is going to come. Please pick up that list, doctor. Call 9000-868-356, our helpline, and take a subscription into the video library of onlineMBBS.com in order to get the entire access. Urinary bladder is lined by transitional epithelium, which is a flexor of abdomen, doctor. Rectus abdominis. Calot's triangle, what will pass? Cystic artery, lymph node of lung, and right hepatic artery. So, bhaiya, a common hepatic duct, a cystic duct, and the inferior surface of the liver, they are the ones which form the so-called Calot's triangle, is what you should remember. Now, how do you evaluate plasma volume? Evon's blue. Where do you find gap junctions? Classically in the cardiac muscle. Gap junctions are those intercellular channels. They permit a free passage between the cells. What do they permit? Ions, small molecules up to a molecular weight of 1000. And typically, how are they made? They are made up of cylinders containing 6 copies of transmembrane proteins called connexins. And cardiac muscle, smooth muscle is the classical locations where gap junctions are predominant. भैया और एक बार बोलना नहीं. Gap junctions, tight junctions, right? Then one more favorite topic of the examiner, different sensory receptors, Pacinian, Meissner, blah blah blah, you should be very sure about. About epithelial sodium channel, which you find in the collecting duct. What is the importance? It can be inhibited by amiloride. It is an epithelial channel. It is present in kidney and also in gut, but it has three homologous subunits, is what you need to remember. Alpha, beta, gamma, they are the various subunits of epithelial sodium channel, is what you need to remember. What is true about smooth muscle contraction? Phosphorylation of the myosin light chain kinase is the one which is involved in smooth muscle contraction. So, doctor, calmodulin plus 4 calcium form calcium calmodulin complex. That in turn will make myosin light chain kinase. It will go and bind with that and make it very active, and that lead to the phosphorylation of the myosin, is what you need to remember. So be very sure, smooth muscle, skeletal muscle contraction, favorite topic of the examiner. Let me tell you, doctor, Anat, physio, biochem, micro, pharma, patho, medicine, surgery. 8 subjects are common between our NEETPG and MDS entrance also. So, हमने NEET MDS last 15 years question bank, All India and NEET MDS का, ये basic clinical sciences का क्वेश्चन बैंक लेके क्लासिफाई करके टोटली 5000 एमसीक्यूज को 200 आवर्स में डिस्कस करके कहाँ फेंक देते हैं हम पूरा वीडियो को? And on the online mbbs.com video library. In that हम फिजियोलॉजी बहुत गर्मा गर्म डिस्कस किए. So please, there are about 750 MCQs in physiology. We have discussed very hot. So please take a chance to review those 750 questions in physiology. If you are doing this, if you are physiology frequently you are doing wrongs. Where is the nerve conduction slowest, doctor? Typically in the C fibers. A fiber, B fiber, C fiber. C fiber में होता है root, dorsal root and sympathetic. C fiber होता है unmyelinated, इसलिए conduction velocity बहुत slow होता है. Preganglionic autonomic is B fiber. Postganglionic sympathetic is typically C fiber. You have to be 100% sure about. Then you have in the A alpha, beta, gamma, delta. Alpha होता है proprioception cervitomotor, beta होता है touch and pressure, gamma होता है motor to muscle spindle, and delta होता है pain, cold and touch is what you need to remember. So this is one favorite question, Dr. Erlanger-Gasser nerve fiber classification. Definitely one question. You can put it in the 300 super hot topic list में ये भी एक है. Dynamic response is because of what, doctor? Primary nerve endings. Cerebellum. Who forms the parallel fibers of cerebellum, doctor? Parallel fibers derived from granule cells, not Purkinje. So output of the deep cerebellar nuclei is always excitatory. Purkinje cell axons are the only output from the cerebellar cortex. Purkinje is called the spokesperson. Medial most nucleus of the cerebellum is fastigial nucleus is what you should remember. So these granule cells, the parallel fibers in molecular layer derived from them. They are all like telephone wires. They all run parallel, highly structured in the cerebellar cortex. Somatosensory cortical lesion, what will affect? It will affect the localization. The only neuron in the retina which shows action potential, वो होता है ganglion cell. Very funda questions है. Compliance of the lung you will measure by amount of the air. So you will draw a graph where on the y-axis you have volume and on the x-axis you have recoil pressure, which will give you an estimate of lung compliance. Thioredoxin reductase. Which amino acid is there, doctor? Selenocysteine. Polypeptide mainly forms एक amino acid एक दूसरे amino acid के बीच में peptide bond. That is the primary structure of the protein. What is the most abundant source of fuel in starvation? Typically it is the adipose tissue, ketone bodies. Mitochondrial membrane has cardiolipin. Aminolevulanic acid is there in the heme synthesis. Hypervitaminosis typically induces damage of the lysosomes. Enzyme decreases the activation energy. Denaturation is resisted by the presence of the peptide bond. In chromatography, mass movement is because of the diffusion. In starvation, the brain will be using the ketone bodies. What is a lag phase, doctor? The time taken to adapt to the new environment when the bacteria are growing is called as lag phase. Whenever there is a transplacental antibody going to the newborn from the mother, it is called passive immunity because it does not elicit any immunological memory. Active immunity क्या होता है? जो immunological memory को elicit करता है, उसको active बोलते हैं. ट्रांसप्लासेंटल एंटीबॉडी टू न्यूबॉर्न इज नॉट एक्टिव, मेमोरी नहीं होता, इसलिए पैसिव इम्यूनिटी है। अल्टरनेटिव कॉम्प्लीमेंट पाथवे, बैक्टीरियल सरफेस पॉलीसैकेराइड। भैया वीडीआरएल क्या है? कल हम आपको पूछा, क्या पूछा भैया? नाइग्लर्स टेस्ट क्या होता है बोल के पूछा। वो होता है न्यूट्रलाइजेशन रिएक्शन। सो VDRL is a precipitation test. Shadow casting, where do you use doctor? Electron microscopy में a sample on copper grid is placed into evacuated chamber. Heavy metal like chromium, palladium, platinum, uranium is evaporated at an angle from a filament. So shadow casting will improve the contrast and adds to the depth of the image. That is a electron microscopy. हमको तो रेगुलर माइक्रोस्कोप ही मालूम नहीं आए, ऊपर से तू क्या बोल रहे हैं, इलेक्ट्रॉन माइक्रोस्कोप के बारे में बात कर रहे हैं। ऐसा होता है एंट्रेंस, राइट? हाँ। The bacteria that does not die during pasteurization at 72 degrees. Coxiella burnetii, Q fever organism. What is the mechanism of resistance to methicillin in methicillin resistant Staph aureus? Fundamentally, there is an alteration of the penicillin binding protein, right? And that lead to the development of MRSA. Hemolytic uremic syndrome, microangiopathic hemolysis, cystocytes. What will you remember? E. coli is the most common cause, which is not a RNA virus. Oh my God. A DNA virus, RNA virus, double-stranded, single-stranded. Abba! Painful proctalgia fugax. But still we need to. Examiner will filter लगाएगा, इसलिए पढ़ना पड़ेगा। पूरा भारत में हम all 100 people who are attending now, for all of us, nobody is naturally gifted with any special brain or memory. Everyone mug up करना ही पड़ेगा। एक क्लास होने के बाद कोई क्वेश्चन पूछे तो मैं रॉन्ग करता हूँ, right? So, but you need to make this list. This kind of thing should get into your 200 pages notebook. फटाफट बोलो डॉक्टर, आरएनए वायरसेस में सेगमेंटेड आरएनए वायरस क्या होता है? रोबा, रियो, आर्टोमिक्सोबुनिया, एरिना। आरएनए नेकेड वायरसेस. When will you make the person naked? While you are doing parrectal colonic exam. So P. picorno, R. rio, C. calci are RNA naked. RNA enveloped. Typically reserved police force is all, they are all wearing uniform now. So you can remember RPF cot, rhabdo, paramyxo, they are all RNA enveloped. So some way you try to remember doctor. Definitely एक क्वेश्चन आता है DNA RNA में, which is single stranded DNA, double stranded RNA, which is coated, which is naked, which is covered. फिर भी पढ़ना है. You'll promise me that you'll review. Already we made one funny video in the youtube.com/onlinembbs about how to remember this. You can review that video, right? Now, the virus causing shingles, it remained dormant in dorsal root ganglia. Methyl-dopa, clonidine, moxonidine, they're all centrally acting, not minoxidil, which is a beta-lactam antibiotic, imipenem. Now, if you look at the greasephulvin, it will not increase, it will decrease because it is the inducer, is what you have to remember. Greasephulvin is fungistatic, given orally, half-life 24 hours. It induces. Greasephulvin makes great. P450 become great. It induces, is what you have to remember. And it should be given 2 to 6 weeks, not just 1 or 2 days. For the skin and hair infection, to allow the replacement of the infected keratin by resistant keratin. Now, maximum effect of bronchodilation, so that you can use in acute asthma. Always acute asthma में Air Force के जैसे powerful क्या होता है? Salbutamol, that is beta 2 agonistic drugs. Cerebellar ataxia. चलो, come on, punch your answer, doctor. Question number 245. Yeah, please punch your answer. Let us make it two-directional. Love is two-directional, not a single directional, no? So, come on, punch your answers. Amma ji bol raha hai cytarabine. Indira ji bol raha hai chloramphenicol. Prasoon Vaidya, Jagadishwari, Devayan, Shiraz, everyone is saying cytarabine. cytarabine. मेरे प्यारे भारतवासियों, ये टेबल भूलना नहीं, एक क्वेश्चन आएगा. हैंड फुट डिजीज, कैपिसिटाबिन, cerebellar ataxia, cytarabine, SADH peripheral neuropathy, vincristine, B for vinblastine, B for bone marrow suppression, paclitaxel, allergy, peripheral neuropathy, etoposide, secondary leukemia, doxorubicin, daunorubicin, cardiotoxic, L-asparaginase, allergy, pancreatitis, hypercoagulable state, imatinib, rash. That is what, among many things that you need to bug, batti. This is also one. Sulfonylureas, they are insulin secretagogues. Digitalis can lead to morbid type 1 heart block, bradycardia because of its vagomimetic action, yellow vision. Mannitol, contraindicated in pulmonary edema. Typically, whenever severe renal disease, congestive heart failure, pulmonary edema, hyponatremia, anuria, intracranial hemorrhage, then it is contraindicated. Mannitol, the osmotic diuretic, is what you need to remember. Acute gout में, what is the drug used? Question number 249. Punch your answers, doctor. If you go wrong, I will celebrate. If you are right, I will also celebrate. Whatever it is, I will celebrate. Come on, punch your answers. Drug used in acute gout. 249. Shikamunka. Clean bone. Lavi Singh, Amit Jain, Lavi Singh, allopurinol. Oh, no. Lavi Singh, you cannot make me cry like that. Devayan, oh, come on, Devayan. You can't do wrong. You can't do wrong. Already Devayan तेरा photo में लगा दिया toppers list में. So you can't do wrong. Doctor, acute gout में you will never use any uric or uric acid lowering drug. It will precipitate. You can only use anti-inflammatory. Preferred is NSAIDs. You can also give steroid. So please don't forget, NSAIDs, corticosteroid, colchicine are acute. Then what are the drugs used in chronic gout? Those which inhibit the uric acid synthesis, like allopurinol, febuxostat, or increase the uric acid excretion, like probenecid, sulfenpyrazone, which is uricosuric. That is what you need to emphatically remember, doctor. What are the adverse effects of the quinine? Quinine can cause hypertension, hypoglycemia, black water fever, not bullseye retinopathy. That is the nature of chloroquine. So quinine lead to synchronism, nausea, vomiting, tinnitus, vertigo, headache, mental confusion, diarrhea, flushing, visual defects. And if you give rapid IV injection, it can lead to hypertension, cardiac arrhythmias, it can lead to a profound hypoglycemia, is what you need to remember. Alprostadil is used for P for prostaglandins, P for PDA, P is called patency. So patency के लिए prostaglandins, closure के लिए indomethacin. That's what you should remember. No confusion. Erectile dysfunction, congenital heart disease, in all that you use alprostadil. Prophylaxis of the migraine के लिए you will use propranolol. ACE inhibitors, why do they decrease the mortality of CHF? Because they prevent the remodeling of the heart, is what you need to remember. अरे वाह, हमारा संख्या 93 हो गया. अरे यार, दोस्तों को बुलाओ. Still another 40 questions discussion बाकी है. हम 100 क्रॉस करेंगे. It will be like Rohit Sharma's 1 ton delivery. So every time our discussion, I want at least 1 ton of students. So please tell your friends to join. Every day afternoon 2 to 4, we have the grant test, full scale grant test discussion until January 4th, right? And every day evening 8 p.m. we will upload the full scale grant test. So please do subscribe to our online mbbs.com video library, take the test, get an access to 2 lakh PowerPoint slides, 1000 plus hours of video lectures, 30,000 MCQs, classified into 953 topics. You get everything on the online mbbs.com video library. So tell your friends to join and also tell your juniors. Hey, Dr. Murali Bharadwaj hai na, completely unemployed MD General Medicine. So January 6th से 5th आपका एंट्रेंस है ना, छोड़ देंगे. 6th से 2020 once more till January 4th of 2021 आपके जूनियर्स के साथ हम रोज 2 घंटे चर्चा करेंगे. संडे को ग्रैंड टेस्ट डिस्कशन करेंगे. एवरी सैटरडे को सब्जेक्ट टेस्ट डिस्कशन करेंगे. मंडे टू फ्राइडे every day 2 hours, 60 to 70 MCQs live review करेंगे. और they also get an access to the entire video library. You can tell your juniors to join and subscribe to the online mbbs.com video library. What drug is used in drug-induced Parkinsonism? Centrally acting anticholinergic like biperidine. Biperidine, procyclidine, trihexyphenidyl, they are all centrally acting anticholinergics which are used in drug-induced Parkinsonism. So what drugs lead to Parkinsonism? Anything that depletes the dopamine, like antipsychotics, antihypertensive like reserpine, antiemetics like metoclopramide and prochlorperazine. They are all drug-induced Parkinsonism. Bromocriptine is also used to treat diabetes. These are all cellular adaptations. What are they? Hypertrophy, hyperplasia, metaplasia, they are all adaptations. What is a irreversible cell injury, doctor? Moth-eaten appearance of cytoplasm. So any increased histophilia because of the loss of RNA, a glassy homogeneous appearance due to loss of glycogen, vacuolated or a moth-eaten appearance, myelin figures, and on electron microscopy, dilatation of mitochondria, amorphous densities, classical of irreversible changes of cell injury is what you should remember. So Satya is saying, sir, B also should be the answer. Absolutely, right, agreed. Amorphous densities also is B, correct. Good point. Caseous necrosis is seen in TB, syphilis. Syphilis में कहाँ होता है? नहीं होता ना? Syphilis should be the answer, right? I think there's a small error. What is the hallmark of programmed cell death? Apoptosis, once more. Apoptosis, bad gene, Baxter gene, O gene, A gene, all that of apoptosis. You should be ready to enter into 200 pages notebook and do the revision, doctor. Apoptosis also super hot. 300 topics ka one of the topic hai. There will be no exam, there will be no NEETPG without apoptosis. Now, metastatic calcification means hypercalcemic conditions like renal failure, multiple myeloma, breast cancer, but atherosclerosis is dystrophic calcification. Psammoma bodies, they are calcified concretions seen in meningioma, concentric horrelled appearance is what you need to remember. So, कल के एग्जाम में एग्जामिनर ये horrels of psammoma bodies डिट्टो यही स्लाइड आएगा कल के एग्जाम में. Endothelium leukocyte interaction during inflammation. What is it because of? It is because of selectins. Selectins are a unique family of 3 adhesion molecules that are expressed and function only on the cells in the vasculature. And why it is called selectin? Because it has a lectin domain. Selectin will mediate the first step which is required for the immigration of the leukocytes from the bloodstream, tethering the leukocyte inflow. E selectin, L selectin, P selectin, endothelial leukocyte platelet. They are divalent cation dependent glycoproteins and they are carbohydrate binding is what you have to remember. Then what are integrins? They are transmembrane heterodimeric glycoproteins is what you need to remember. Then what are cadherins? Calcium dependent adhesion molecules. You have N-cadherin, P-cadherin, E-cadherin, neural, placental and epithelial. And one of the theories why breast cancer occurred, the failure of cadherin mediated cell-cell adhesion cascade is implicated as a pathophysiological event leading to the development of the breast carcinoma is what you need to remember. Now in acute inflammation, what do you see, doc? Vasodilation, increased vascular permeability and the stasis of the blood. Allergic rhinitis where histamine is involved, which is not acute phase reactant, favorite question of the examiner. C-reactive protein, fibrinogen, serum amyloid A, they are all implicated. Once more, what are positive acute phase? What are negative acute phase? Albumin, transferrin, their levels will fall down whenever there is inflammation. They are called negative acute phase reactants. Be very sure on this table also, doctor. Abba. Pressure ulcer classification. पहला प्रेशर अल्सर्स, ट्रोफिक अल्सर्स मालूम होना बड़ी बात है, उसके ऊपर से क्लासिफिकेशन. अच्छा भैया बोलो, if dermis is involved and fat is visible, which class? Stage 3. चलिए फटाफट बोलो. Intact skin with non-blanchable redness, stage 1. Partial thickness skin loss involving epidermis, dermis are both, stage 2. Full thickness tissue with the full thickness tissue loss with visible fat दिखाई दिए तो 3. Full thickness tissue loss with exposure to bone दिखाए तो, muscle दिखा दे रहे तो, नहीं तो टेंडन दिखाई दिए तो उसको क्या बोलते हैं डॉक्टर? स्टेज 4. बी वेरी श्योर. Varicose tract depends on stasis, endothelial injury, and it talks about the risk of intravascular thrombus. Endothelial activation is increased expression of all those adhesion molecules that will enable the leukocyte recruitment. अभी बट्टी मारने वाला चीज आ गया. Secondary, primary type of amyloid in various conditions. So secondary होता है rheumatoid arthritis, TB, renal cell carcinoma, not in multiple myeloma. अच्छा भैया बोलो, ये type of amyloidosis, chronic inflammatory conditions like rheumatoid arthritis, TB, Mediterranean fever. Similarly, AL type, systemic monoclonal light chain, like multiple myeloma, Waldenstrom macroglobulinemia, B-cell lymphoma, AL type. Then transthyretin. Then normal TTR, senile systemic amyloidosis with a gradual heart involvement. MET30 is in familial amyloid polyneuropathy. MET111 is familial amyloid cardiopathy, and beta-2 microglobulin is hemodialysis associated amyloidosis. That is what you need to mug it for the tomorrow's exam. Which fixative is used in histopathology? 10% buffered neutral formalin. In acute starvation, feeling of intense hunger, it will be there only for 36 to 48 hours. Fingerprinting is the most specific method of identification. Scalpel laceration looks like an incised wound. The substance commonly used for the histopathological examination hota hai formalin. Absorption elution technique is used for blood group detection. James Lind क्या दिया? नींबू का पानी पिलाया पूरा sailors को and prevented the development of the scurvy. Who is a true epidemiologist? Too much, no? It is like asking a child, you love mama or you love papa? Whom do you love? अरे ये true epidemiologist है, मतलब सारे epidemiologist फालतू हैं, हमारा SPM प्रोफेसर भी फालतू है क्या? हाँ, I don't know how do they compose such questions. Aristotle. Principle of Chinese medicine होता है yin yang. Being model of disease causation. What is the being's model? भैया being's model में B is biological factors which are innate to the human being. Behavioral factors, individual lifestyles. Environmental factors, physical, chemical and biological aspects of environment. Immunological, nutritional, genetic, social, spiritual, service. They are all the various causation factors leading to the disease which is called being's model. Food fortification, वनस्पति डालडा में विटामिन ए ऐड करना, क्या कर रहे हैं आप? हेल्थ प्रमोशन. Impairment क्या होता है? Loss of anatomical structure is impairment. So any loss or abnormality, psychological, physiological or anatomical is called impairment. Restriction, inability to perform a function that can result from the impairment होता है disability. Handicap, disadvantage that results like loss of employment is called typically handicap. Now the denominator in secondary attack rate होता है number of person weeks, months or years of exposure, that is the denominator. इन चीजों में ये सब fertility rate, reproductive rate. इसमें which will consider mortality. अच्छा भैया देखेंगे आप कितना पढ़ाई कर रहे हैं. चलो, come on, punch your answers, doctor. Punch your answers. Yes. Prasoon Vaidya is proposing D. Ammaji. Ramu, Satya, Jagadish, तिवारी, सब लोग एक ही बात पे हैं, मगर 001 ऐसा कैसा रॉन्ग कर रहा है? It is net reproduction rate, doctor. Net reproduction rate is nothing but the gross reproduction rate adjusted to the mortality schedule of the cohort of women. That is the number of daughters that would be born to a cohort of women during their lifetime, if they experienced a fixed schedule of mortality rate, is what? Net reproduction rate. Net reproduction rate of 1 means exact replacement. And net reproduction rate is always lower than the gross reproduction rate. Why? Because net reproduction rate will take into account that some women will die before they complete their childbearing years. That is what you need to basically remember. Right? Ammaji is asking, sir, once more, can you please explain impairment and disability? क्यों नहीं बेटा? Impairment क्या होता है डॉक्टर? नीट पीजी में सीट नहीं आना होता है, क्वालिफाई भी नहीं होना होता है, इम्पेयरमेंट, लॉस ऑफ एबनॉर्मेलिटी, लॉस और एबनॉर्मेलिटी, साइकोलॉजिकल, फिजियोलॉजिकल और एनाटॉमिकल स्ट्रक्चर और फंक्शन. देन व्हाट इज डिसेबिलिटी? अगर एमडी में सीट नहीं है तो कोई भी अपना बेटी को शादी में नहीं देता. Nobody will offer their daughter's hand to you. That is restriction of ability to perform a function. क्या function? Marriage function. That may result from this impairment. That is not getting NEETPG seat. Handicap क्या होता है? Basically, what is the fulfillment of a role? If you marry, you will become good husband, good father, good grandfather. वो सब नहीं हो सकता ना. शादी नहीं हुए तो कोई भी अपने लड़की को नहीं दे रहे तो that is called handicap. समझ में आ गया ना अम्मा? अम्मा जी, नागरेड्डी, good. So now doctor, case control study, where do you do? Typically, if the disease is very rare, how can you do a cohort? Cohort study you can't do. Cohort means large population you require. Will you get a large population of Down syndrome? No, you can't. So whenever the disease is rare, you will take 10 without Downs, 10 with the Downs, compare the two. That is called case control, typically done in rare diseases. That's what you should remember. Suspected cause preceding the observed effect. Observed effect is an example of temporality. Suspected cause preceding the observed effect is called temporality. देखो भैया, नीट पीजी में आप टॉपर बन गया समझो. हम जैसे एक कमर्शियल कोचिंग सेंटर वाले आके आपसे पूछा, भैया आपका नाम क्या है? अच्छा, तो आप हमारे लिए जरा एक इंटरव्यू देते क्या? दे दो ना, बोलते. So that is what. You never attended coaching, but ultimately someone claims. Now you are attending, and then later on you become topper. हम पूछता भी नहीं, आप ही बोलेगा, अरे उस दिन YouTube में लाइव ब्रॉडकास्ट में हम भी है मेरे भाई, आज मैं MD में टॉप रैंक आया. That is called temporal relationship between two things, etiological factor and the appearance of the disease manifestation. A disease must fulfill the criteria for screening. What are they? If you want to screen the disease which is important health problem, like dengue fever. Natural history of the disease should be adequately understood. First entomologist will tell. Then there should be an effective treatment. Satya says good joke, sir. Correct. कभी कभी टॉपर बोलता है मैं ये कोचिंग को भी गया, वो कोचिंग को भी गया, आपको भी कोचिंग है तो बताओ, मैं आपके पास भी आ गया. तो कितने कोचिंग को हम भी जाएंगे, राइट? सो दैट बिकम चैलेंज. द सेम एवरी कोचिंग सेंटर विल अपलोड द यूट्यूब वीडियो ऑफ द टॉपर सेइंग दैट आप कैसे पढ़ाई किया, आंखों को इस्तेमाल करके, कहाँ पढ़ाई किया, बुक में देख के, और कैसे पढ़ाई किया, अरे आपके साथ पढ़ाई किया. So that's what it's common. I wonder, अरे इतना कोचिंग कैसे अटेंड करते लोग? But one thing is true. Any mentor, you require one cohort of classmates who are also serious. You require some mentor who is also like a joker like me, who can be able to spend time with you like a NEETPG aspirant every day, throughout the year, until you get the seat. Marriage was rehta na, until the death parts each other, we will remain in love, like that. So fundamentally, you should have a mentor who is there with you at all times. कल के एग्जाम है या एक साल के बाद भी है, अगर तेरे साथ है, रोज पढ़ रहे आपके साथ, that is more, that is a true mentorship. That's how people used to build gurukuls, right? हाँ, so that's the point of that. Now, true positive क्या होता है? What is true positive? Patient tested positive and he's also having disease. A herd immunity, more than how much is required to prevent epidemic spread of diphtheria? 70%. Best method to prevent coronary heart disease. Always primordial prevention is always the best method, even before the emergence of the risk factor. Even before the emergence of the risk factor, if you are able to initiate a preventive measure, वो होता है primordial. Newborn care corner. Where should it be present? Labor room में अभी पैदा होता है ना NEETPG topper, एक entrance material रखे, उसमें उसको you have to make him to lie down, wrapped in the entrance material, right? That is newborn care corner. First year MBBS से ही अगर entrance orientation शुरू कर दिया तो, so labor room में क्या क्या रहना डॉक्टर? How do you assess? Labor table, Macintosh sheet है, suction machine sister, suction machine लाओ, oxygen cylinder ready है क्या? 24-hour water supply is there or not? Water disposal, 24-hour electricity attached to the toilet. Then designated newborn corner. What is that? Radiant. It should be warm. Separate drug tray for the baby suction cannula, pedal suction machine. Mucus extractor, embo bag. So, Breno, labor room mein, right? Be very sure. That is called the newborn corner. Last 10 questions before we say goodbye, doctor. Which parameter is best to know the fetal growth? Abdominal circumference is much better than head. 6th month में pincer grasp नहीं आएगा. Monosyllable sounds. Amma, appa will come. And watching self in the mirror. Sitting in tripod position. ये सब बात है. So he begins to string vowel sounds together, rolls from the front to back and back to front, starts solid foods with 1 to 2 spoonful, sleeps about 11.5 to 14 hours. One more time is during NEETPG preparation, 6 months हम reading room में आराम से snoring we will be sleeping, right? So that is the time. So be very sure, doctor, developmental milestone, super hot 300 MCQs में 300 topics I told you, no, developmental milestone. If you did this wrong, you have to be very sure. 6 months, you need express reach and transfer object. 9 months, immature pincer grasp, probes with forefinger. 12 months, pincer grasp become mature. 15 months, he imitates scribbling, tower of 2 blocks. 18 months, tower of 3 blocks and scribbles. 2 years, tower of 6 blocks, vertical and circular stroke. 3 years, tower of 9 blocks and copies a circle. 4 years, copies a cross. And by 5 years, triangle, Pythagoras, पैदा हो गया. By 5th year, is what you need to remember. Autism बोलने के लिए, what is the onset? Typically, in autism, there is a repetitive behavior, delayed language, severe deficit of social interaction. But onset is before 3. You should remember when it comes to autism. So, impairment of social interaction, communication, imaginative play, and apparent, it becomes apparent before the age 3. 6-year-old drowsy child suffering from vomiting, sunken eye, hypothermia, skin on pinching goes back but very slowly. That means he has dehydration. Severe dehydration, you must be very sure on that table, है ना? No dehydration, mild, severe, some dehydration also. Hot topic for the examiner. क्वाशियोर्कर के ट्रायड में क्या होता है? Growth retardation, edema and psychomotor changes. Neural tube defects, how do you prevent? You have to give folate supplementation. In case of an infant having congenital TB, अच्छा देख लेंगे. Who will give me the correct answer for this question? Come on, punch your answer, doctor. In case of an infant with congenital TB, not just TB, congenital TB. What is the most common site for the primary focus? Punch your answer, doctor. Ammaji, Syed, Satya, Jagadish. अरे आप सबको मालूम है क्या? हाँ, अमित जैन इज रॉन्ग. अच्छा, आई एम हैप्पी. एटलीस्ट वन रॉन्ग नहीं है तो हमको खुशी नहीं मिलेगा. हाँ, so it is liver. So Cantwell criteria. What is that called? Cantwell criteria. What is that? For congenital tuberculosis. Proven TB with at least one of the following. Lesions of the newborn baby should be in the first week to call it congenital. Primary hepatic complex or a caseating hepatic granuloma. Tuberculous infection of the placenta or maternal genital tract. And exclusion of possibility of postnatal transmission because of the hospital staff. Sister Lily is coughing into the baby. Baby got TB. It is not called a congenital TB. Is what you have to remember. Now, neonatal bradycardia. It can occur with head injury, hypoxia, hypothermia. Now, newborns. What is the way of thermogenesis? Not by shivering. Newborn शेर है, मेरा बेटा शेर है. शेर शिवर नहीं करता है. Breakdown of the brown fat, universal flexure attitude, cutaneous vasoconstriction, they are the methods of thermogenesis. A child presented at 18 months of age, he was never been vaccinated before. Obviously, you have to give BCG, MMR, OPV, pentavalent vaccine is what you should remember. Thank you so much, doctor, for this wonderful evening. 2 hours, 3 minutes में खत्म कर दिया. So doctor, once more, let me tell you, every day 8 p.m. test become uploaded into online mbbs.com video library, right? .com video library. Then every day 2 p.m. to 4 p.m. don't forget, we have a live online discussion on this YouTube. And after this discussion, we will be removing this video and we will be uploading it into the online mbbs.com video library under the test. And those who have not yet joined and subscribed, please do subscribe today only for the grant test, everyday grant test until January 4th. You will also get an access to the video library. Some students say, only 1 month na mujhe seat aa gaye to you can gift your account to any of your other friends. Seat nahi aaye to you will get a 50% discount for the next 1 year of access of the video library. So that is the reason, take a call today and then subscribe to our online mbbs.com video library. And doctor, as usually, बेताल ने विक्रमार्क से पूछा, बहुत अच्छा कहानी सुनाया और वक्त आ गया, मैं जा रहा हूँ, फिर पेड़ के ऊपर चढ़ गया. So, like a Chandamama story, every day we will solve 300 questions and we will have a discussion. Have a wonderful evening and we will all meet tomorrow. Have a great day.